Hi everybody, we're going to be learning about the 4 types of shock in this module. So let's begin. What is shock? Shock is a syndrome characterized by decreased tissue perfusion and impaired cellular metabolism leading to an imbalance between supply and demand of oxygen and nutrients. When a cell is in a state of hypoperfusion, the demand for oxygen and nutrients exceeds the supply. In other words, shock is a clinical syndrome characterized by inadequate tissue perfusion resulting in end organ dysfunction. Obstructive shock. Obstructive shock is a physical obstruction of blood circulation and inadequate blood oxygenation. In other words, this is when blood can't get where it needs to go. Examples of obstructive shock can be related to a pulmonary embolism, which is an interruption of blood flow, a pneumothorax, which is a buildup of air or fluid, a hemothorax, a buildup of blood between chest wall and lung, or even cardiac tamponade. This is when blood or fluids fill the space between the sac that surrounds the heart and heart muscle. In other words, you've come to a roadblock. Cardiogenic shock. Cardiogenic shock occurs when systolic or diastolic dysfunction of the pumping action of the heart results in compromised cardiac output. Now, systolic dysfunction primarily affects the left ventricle due to systolic pressure and tension that is greater on the left side of the heart. When systolic dysfunction affects the right side of the heart, blood flow through the pulmonary circulation is compromised. Cardiogenic shock is also known as pump failure. This is when the heart suddenly cannot pump enough blood to meet the body's needs. Examples of cardiogenic shock could be a myocardial infarction. This is when there is a lack of oxygen to the heart and damage to the left ventricle. Congestive heart failure can be contributing, or even a blunt cardiac injury. Signs and symptoms of cardiogenic shock can differ depending on if it's an early presentation or a late presentation of this type of shock. For example, early presentation is pretty similar to when a patient has acute decompensated heart failure. Patient's response to low blood flow may include tachycardia, hypotension, a narrowed pulse pressure, tachypnea, pulmonary congestion. They may have crackles in their lung fields. They may have signs of peripheral hypoperfusion, which could include cyanosis, pallor, coolness, clammy skin, decreased capillary refill. They may also have signs of decreased renal blood flow, or even they may be anxious, confused, or agitated related to cerebral perfusion impairment. So one of the hallmark signs of cardiogenic shock is rapid breathing, severe shortness of breath, sudden rapid heartbeat, and loss of consciousness. This also can include low blood pressure, sweating, and, like stated previously, decreased urine output. Now, if you're looking at a set of labs, what can stick out to you in a cardiogenic shock patient is an increase in one's troponin, an increase in blood glucose levels, an increased BUN. If they have an EKG, there may be dysrhythmias, or if they have a chest x-ray, you may even see pulmonary infiltrates. Now, how would you treat cardiogenic shock? Well, you would identify and treat the underlying cause, but you may need to look into lifestyle modifications as far as what is this patient taking as far as medications go. To treat them right away, you may need to use inotropic agents such as norepinephrine or dopamine to increase the heart's pumping ability. You may need thrombolytics or antiplatelet medications, and if it's severe enough, they may have to go to the cardiac cath lab and may need a stent or a balloon. Next, we have distributive shock. Distributive shock, I tried making this as easy as I could. What distributive shock is it's an excessive vasodilation and impairment of the distribution of blood flow. So vasodilation is a hyperdynamic process. This is when blood vessels lose their tone and become so open and floppy that there is just not enough blood pressure that can supply organs. Now, the reason for these pictures is you've got your blood vessels nice and sturdy. However, in distributive shock, they literally lose their tone and become floppy, almost like a noodle. Now, distributive shock is actually classified into two types of shock. There's anaphylactic shock. Anaphylactic shock is an acute and life-threatening hypersensitivity, or in other words, allergic reaction. An immediate reaction causes massive vasodilation and release of vasoactive mediators and an increase in capillary permeability. Now, as you can see in this slide, a little insect such as this bee can cause this much trouble for a little boy. As fluid leaks from the vascular space into into the interstitial space, it can lead to respiratory distress due to laryngeal edema or even severe bronchospasm. Signs and symptoms of anaphylactic shock include dizziness, chest pain, the swelling of lips or tongue, wheezing, stridor, angioedema, anxiety, and confusion. Now, anaphylaxis can develop as a result of drugs. If someone has a penicillin allergy, for example, if you're bitten by a poisonous snake, or even if you are stung by a bee. Some people have severe allergies to pollen. Some people are allergic to blood products. And of course, foods, like the people that you know that are severely allergic to peanuts. The next type of distributive shock is septic shock. Septic shock is systemic inflammatory response to an infection. The presence of tissue perfusion abnormalities and the initiated body response to an antigen is exaggerated, and there's an increase in inflammation and coagulation. Signs and symptoms of septic shock include increased cardiac output, GI dysfunction such as GI bleeding, paralytic ileus, respiratory failure, alteration in neurological status, warm and flushed skin, and then they can become cool and mottled in the later stages of septic shock. There's also different types of septic shock, like I had talked about earlier, in different types of shock. There's early septic shock and there's late septic shock. Early septic shock can cause reduced diastolic blood pressure, and this is where the warm extremities come in and the flushed appearance come in. Late septic shock is a reduction in organ perfusion resulting in hypoperfusion of the heart, brain, and liver. Treatments for septic shock and anaphylactic shock are the following. To go back to anaphylactic shock, antihistamines, bronchodilators, and corticosteroids can be used. For septic shock, this is when epinephrine, hydrocortisone, vasopressors, and even antibiotics come into play. IV fluids are also a big important aspect to think of as far as nursing interventions, and we'll go into this later in the module. Our next type of shock that we're talking about is hypovolemic shock. So what is this and why am I looking at a leaky faucet? Well, hypovolemic shock is a second type of a low blood flow shock. What this means is this occurs when there's a loss of intravascular fluid volume and the volume is inadequate to fill the vascular space. Now, there are two types of hypovolemic shock, and they are classified under absolute and relative loss. So intravascular volume loss is rapid fluid loss. that result in multiple organ failure due to inadequate circulating volume and subsequent inadequate perfusion related to a medical or surgical condition. So, going back to absolute hypovolemia versus relative hypovolemia, in absolute hypovolemia, this is when fluid is lost through hemorrhage, GI loss such as vomiting or diarrhea, or even if someone is diuresing just a little bit too much. Then you have relative hypovolemia. This is when fluid volume moves out of the vascular space into the extravascular space, also known as third spacing. So this is just a leakage of fluid and pooling of blood or fluid such as a bowel obstruction, an internal bleed, or even massive vasodilation. Signs and symptoms include increased heart rate and cardiac output, increased respiratory rate, patient may appear anxious, and urine output will decrease. Diagnostic findings include decrease in hemoglobin and hematocrit if they were having a hemorrhage or blood loss. Urine-specific gravity is seen to increase, and lactic acid seems to increase in these hypovolemic shock patients. As far as treatment goes, you really want to take into consideration IV fluids. You want to replace all this fluid that they are losing. So your go-to is a crystalloid fluid replacement. This can be normal saline. Now, if they are losing a lot of blood, this is when you would think, okay, maybe they need to have a blood transfusion. So it all depends on what's going on, how are they losing all this fluid, and what the doctor initially orders. But like you need to critically think and try and figure out what is going on with your patient. Lastly, shock prevention. There are actually several types of ways everybody, including yourselves, can prevent shock. For example, anaphylaxis, allergies. If you have severe allergies, avoid those triggers. If you have an allergy to bees, carry an EpiPen around with you. To lower risk of blood loss from injuries, like we were talking about hypovolemia, wear protective gear. Lifestyle modifications include avoiding smoking. To lower chances of heart damage, eat a well-balanced diet and exercise regularly. And most importantly, stay hydrated. Thank you.